Okay, this is my short video from my internship experience for completing the course PUBH 889. So here's a quick outline. First, I'm going to tell you who I am and where I was, what the deliverables and the competencies were that I was trying to accomplish, some of the key learnings gained from this experience, and also, my overall experience in terms of challenges and achievements. So I graduated from the School of Medicine from St. George's in 2020. I have a background in two bachelors, one in arts and the other in sciences, biochemistry and politics. Currently, I work in Sarnia at the Wellness Clinic, and I function as an unlicensed doctor, seeing patients on the walk-in side, but soon now, recently we brought in a family practitioner, and I will be assisting seeing his rostered patient load, practicing family medicine. So I was at the Caribbean Public Health Agency. The head office is at Trinidad and Tobago, the Port of Spain. There's also two other offices, one in Jamaica and one in St. Lucia. So the mission of CARPHA is a professional organization to build member states' capacity to prevent disease and promote health and wellness through leadership, partnership, and innovation. So the structure here is, I believe there's like 26 member states all throughout the Eastern Caribbean, which is often referred to as the small island developing states. These places are at great risk of climate changes and climate disasters. And what the function here was to try to manage non-communicable diseases, things like hypertension, heart disease, mental health issues, food security, during these events of catastrophe. So I was part of the Chronic Disease and Injuries Unit, and my supervisor was Heather Armstrong. This was a 6-week practicum from April 7th to May 16th. I finished early September because I was working so much. Dr. Armstrong was tremendous in allowing me to have time to finish some of my requisites. There was an assistant, and we tried to plan for weekly bi-monthly meetings if it were possible. However, it was sometimes hard to generate this stuff. But she was very helpful. So some of the things that I focused on, and it was very nice that CARPHA and the department had everything structured for me to do. So the first part was about research, building a digital repository about all the information on non-communicable diseases and how they're structured within emergency preparedness response tactics from different parts of the region. These were guidelines, roadmaps, bits of information, basically from the World Health Organization, Pan American Health Organization, and the CDC. It had to be, reputable sites. So I compiled about 50 bits of data with simple annotations providing the link. I also was part of the Building Capacity annual workshop that prepares for the 78th World Health Assembly, as sponsored by the United Nations and the World Health Organization. But for this structure, I actually produced a position paper. And it was kind of like our stance and expected outcomes and strategies put forth to help manage the situation of non-communicable disease and emergency preparedness. Finally, I had a Public Health Day celebration where I did basically a little literary review and tried to add some sort of advertisements or social messaging or public communications for different sorts of audiences. And that was based on sickle cell disease, which is pretty prevalent in the area. So the third capacity workshop meeting was pretty enormous. It was 2 full days in Barbados, and I attended this virtually. Everything I did was virtual, actually, to be honest. But there was all sorts of representatives from the area for this massive meeting where there were lectures, there were breakout rooms, there were topics, there were simulation exercises. And this was really public health in action, sort of building up the initial phases of tackling non-communicable diseases. The area has been very successful at handling communicable diseases, but now they're sort of evolving and progressing to the next level, next phase of public health, so to speak. And here's just an example, just a couple of the partners that were in attendance. What I was very happy to learn about was how non-communicable disease management and emergencies is part of the World Health Organization's um, Sustainable Development Goal targets. And you can see right there, there's the three central access points. Really, it's about maintaining universal health care and primary healthcare services through and beyond disaster events. Part of this was held, this is an example of how the breakout rooms were organized and how we developed some of the aspects. I was kind of a scribe for the non-communicable disease portion, and I submitted my notes to my supervisor to help keep things on point during the meetings, and that was a lot of fun. Here's an example of the repository I developed. Part of the track competency here was about appraising scientific literature in prevention and screening of diseases. So you can tell here, I tried to break it up as best I could, but I was really focused on non-communicable disease. And here's an example of the breakdown. Here are the annotations and the links. This is an example of the position paper I did. It's about a 2-page paper, and it's succinct but very specific. It comes from the delegation, and my position was about integrating non-communicable disease management and emergency preparedness and responses, which is kind of lacking. I mean, most of the time it's been based on maybe some diabetic control medications, but you can do more. You can do more with breathing instruments. You can do more for medications for people with hypertension or heart disease. And a lot of the structure was based on maybe even starting to form a registry of people who have non-communicable diseases and increasing the level of stakeholders involved in supporting the mobilization efforts when disasters strike. So people have certain problems, or if they have mental health issues, they're not going to be off their medicine and also going through a very crazy event. Because you imagine someone who schizophrenic who doesn't have his medication and there's a disaster happening, but a week later they're not going to be very balanced. This was also a track competency, and this was based on strategies used to prevent non-communicable diseases to improve patient outcomes. The World Health Day celebration was about sickle cell disease for me. This was interesting. There was a lot of research done on this. It took some time. It was a big document. Basically, it's about prevention and World Health Day, where the state basically celebrates the situation or the conditions associated around a certain disease to create more awareness for the general public. This was a foundational competency, and this was about select communication strategies for different audience and sectors. So in these situations, I tried to develop either radio advertisements. I developed a script that could be played on the air. I tried to develop pamphlets that would be handed out in schools, different structures for different people and different age categories. Some of the key learning challenges and overall experience I had. So it was a very directed scope of research because we were using credible sites. It really helped cement an awareness of public health and reaffirming my knowledge within the subject. I had a bit of a problem, I guess, keeping things outside the clinical realm, and I had to realize how much backed up we were when dealing with the region in particular which we're talking about. I developed good situations for summarizing agendas and understanding better political situations. Also better understanding the amount of different pieces in play to organize preventative health initiatives and policy. There are many different hats to wear, is what I notice. From non-governmental organizations to nonprofit to heads of state to private organizations to funding to specialists to emergency people. It was quite a bit, and it was fascinating to see how this stuff develops. So that range was huge, and little quote I like to put here is, it takes a village to raise a child, and the child being the region to understand public health better. So it's about enshrining accessibility to health services and removing the minutiae of clinical results. Um, Public health also has to be maintained and reevaluated at certain checkpoints to make sure surveillance is adequate and to reevaluate policy along the way. So some of my time commitment was hard to dedicate to this throughout the full 6 weeks. It would have been great if I was able to do that. I couldn't. So that was a limitation for me. But I gained a strong understanding still of the different layers involved. And completing the tasks was a real achievement because I wasn't really prepared initially beforehand what I was going to be doing. So I was learning at the same time as remembering. Overall, it was an incredible experience. I know it's going to assist my career in family medicine and preventative healthcare, and having to deal with patients, because a lot of the patients I deal with aren't always going to be clinical. It's going to be about where do they live, who do they operate with, what are the social services available to them, what social economic status do they come from. So it improves my quality as a service provider. So I had a lot of gratitude for this learning experience, and I'd like to thank Dr. Armstrong very much for her help in the matter. And here's a little example of my completion of the program. So that's about it, and you can always refer to the final report that accompanies this presentation. Thank you.